This is Unit 1 of the Special Needs Training mandated by the Georgia Department of Education for all school bus drivers. In this unit, we will explain how to recognize students with disabilities. The objective of this unit is to make the drivers aware of the terminology used by educators on the student's Individualized Education Program, also known as IEP, to identify various disabilities. The driver should be able to recognize the characteristics of those disabilities, and the driver should be able to respond appropriately in providing safe transportation for students with disabilities. The performance standard is that the trainee shall be able to identify some various disabilities. As an overview in this unit, we will be explaining what IDEA and IEP means, the descriptions of certain disabilities, and the characteristics of the disability. Why is this important? To be able to recognize different disabilities. By having knowledge and understanding of the many different disabilities, the driver and monitor will be able to recognize the characteristics and accommodate the students according to their disabilities. For example, a student that is autistic may become upset if his routine is changed, such as a new fellow rider or a different seat on the bus. A student that has a loss of both vision and hearing may need extra assistance boarding and disembarking the school bus. You must be able to recognize disabilities so that you can ensure your students have a pleasant and safe bus ride. What does IDEA stand for? It stands for the Individuals with Disabilities Education Act. It is a federal law. The broad objective of IDEA is to require public school systems to provide a reasonable accommodation to students with disabilities to enable them to get the best education possible. With that goal in mind, the law requires the school system to assess each student individually and develop a written plan for how they will ensure that student's success. What does IEP stand for? It stands for Individualized Education Program. Each public school child who receives special education and related services must have an individualized education program. Though the law prescribes certain types of considerations that must be made for all special needs students, each IEP must be designed for one student and must be truly an individualized document. The IEP creates an opportunity for teachers, parents, school administrators, and related services personnel, as well as the students when appropriate, to work together to improve educational results for children with disabilities. The IEP is the cornerstone of a quality education for each child with a disability. Transportation is one of the areas of consideration for students with a disability. Understanding the physical and/or behavioral characteristics which typically accompany certain disabilities is important in making sure that the transportation services mandated in the IEP are implemented properly and that the student experiences a physically and emotionally safe ride. Okay, some real quick review questions here. What does IDEA stand for? It stands for Individuals with Disabilities Education Act. What does IEP stand for? That's the Individualized Education Program. The next few slides cover terminology and characteristics of certain disabilities. And first we're going to discuss autism. Autism is a developmental disability that affects language development, communication, and social interaction. It is a spectrum disorder. Children can be affected to a large or a lesser degree all along the spectrum. That is, they are typically rated on a scale of mild to moderate to severe. Children with autism may exhibit some or all of the following characteristics: repetitive movements, which would include rocking or hand flapping, echolalia, which is repeating what they hear, unusual responses to sensory stimulation, that is to say they have a hard time handling noise or someone sitting too close to them, and then finally resistance to change, any change in the routine such as a substitute driver, a different seat, etc. All people of all ages prefer to have some degree of routine and may be somewhat upset if the routine is disrupted. Students with autism may become extremely upset with a disruption that most students of a similar age would consider to be no big deal. Keeping to a consistent routine as much as possible is a key to successfully transporting students with autism. Recognizing each child's unique characteristics and needs will help the driver in preventing upsets and disruptions. A visual schedule can help keep the student reassured and calm. A behavior management plan may be a part of the IEP. Deaf and blindness. Deaf and blindness is the loss of both vision and hearing, which severely impacts development and communication. These students need assistance boarding and disembarking and should be made to feel as secure as possible once seated. Deaf or hard of hearing. That's defined as hearing loss so severe that it interferes with the development of speech, language, or academic skills. Alternative communication systems which these students may be using include sign language, lip reading, which may be used specifically for the deaf, an interpreter. Depending on their level of ability, they may need an interpreter or other modification. And finally, with modern technology, tablets or smartphones that enable them to use text to communicate. When communicating with hearing impaired students, it is essential to make eye contact. A bus evacuation plan for these students should include a method of getting their immediate attention, such as the use of interior lights or other predetermined signal. Some more study questions. What are the characteristics of autism? The answer would include repetitive movement, echolalia, unusual responses to sensory stimulation, and resistance to change. What is deaf and blindness? The loss of both vision and hearing. And what is deaf or hard of hearing? Either a total hearing loss or a partial hearing loss. Let's talk about emotional and behavioral disorder, commonly known as EBD. Students in this category have one or more of the following emotionally based characteristics, to the degree that their educational performance is affected enough that they need special education services. An inability to build or maintain satisfactory relationships with teachers or other students, an inability to learn, which is not due to intellectual, sensory, or other health factors, consistent inappropriate behavior or feelings under normal conditions, serious depression or unhappiness, a tendency to develop physical symptoms such as pains or unreasonable fears associated with personal or school problems. These students often display behaviors inappropriate to their environment and may have poor impulse control. Behaviors may range from disruptive and attention-getting to very withdrawn. These students often have problems working in groups and poor conflict resolution skills. Calmness and consistency on the part of the bus driver are essential to success in transporting EBD students. Learning to recognize things that trigger behavior and working with school staff to develop a behavior intervention plan, or a BIP, can be very helpful. Question: what are the characteristics of EBD? Remember, EBD stands for Emotional Behavioral Disorder. Answer includes inability to maintain satisfactory relationships, an inability to learn, which is not due to intellectual, sensory, or other health factors. They are consistent in their inappropriate behaviors. They have serious depression or unhappiness, or a tendency to develop physical symptoms. What is BIP? The answer is Behavior Intervention Plan. Intellectually disabled students have intellectual functioning that is well below average and limitations in adaptive, that is to say everyday living, type behavior, such as maturity, independence, responsibility, and school performance, compared with other students of their age. Okay, so what are the characteristics of intellectually disabled? They function well below average, and they have limitations in adaptive behavior, such as maturity, independence, performance, responsibility, and their school behaviors. As mentioned before, many disabilities have different levels that are rated on a scale. These are the degrees of delay. From mild, These students generally have difficulty with academic content, but can usually acquire basic reading and math skills. They may be immature and unable to apply information learned in one setting to another. They may have difficulty articulating needs and wants, and a change of routine can be difficult for them. For a moderate level of disability or delay, these students have a learning level 1/3 to 1/2 their chronological age. They may have delayed motor skills, poor retention skills, and immature social skills. They often experience delays in processing language. They require consistency and structure. Frequent repetition of directions and instruction is helpful, and patience is essential in creating a safe and enjoyable ride for these students. For students with severe and profound delays, these students frequently have coexisting disabilities, vision, hearing, seizures, etc. They may have limited communication skills and may need help in self-care, such as toileting, dressing, or eating. They may need assistance in boarding and physical disembarking of the bus and frequent monitoring during the ride. Many have disabilities that cause them to be non-ambulatory. Other health impairments means having limited strength, vitality, or alertness to a degree that it adversely affects the student's educational performance. This impairment may be the result of a chronic health problem such as asthma, diabetes, epilepsy, or heart condition, etc. It may also be due to a heightened alertness to environmental stimuli that results in limited alertness in the educational setting, often seen in students with attention deficit disorder or attention deficit hyperactivity disorder. Students in this group may have difficulty starting, staying on, and completing tasks, making transitions, interacting with others, and following directions. Because of the varied nature of students who are included in this category, it is important for the driver to get as much information about each student as possible and to work closely with the parents and teachers in meeting the student's transportation needs. Adaptations may be noted in the IEP, and emergency medical plans may be needed. Orthopedic impairment refers to students whose severe orthopedic impairments have an effect on their educational progress to the degree that special education is required. Impairment may include congenital conditions, deformity or absence of limbs, diseases such as polio, cerebral palsy, and amputations. These students may use wheelchairs or other assistive equipment and may need a lift bus. Their physical disability does not indicate an intellectual impairment, and many of these students are served primarily in the regular education classroom. However, the nature of their disability may require significant transportation adaptations, which should be addressed in the IEP meeting. It is important for drivers to receive information and training necessary to ensure the safe transportation of these students and their equipment. Significant developmental delays. This is for ages 3 through 5 or pre-K aged students. This is a term which refers to young students who have delayed development in intellectual communication, adaptive behavior, social, emotional, or motor skills to the extent that if they are not provided with early intervention, their educational performance may be adversely affected. These students can be served in a variety of programs. When they ride the school bus, they will need help with following directions and getting on and off the bus. Each student should be transported in a child safety restraint system appropriate for his or her size, weight, and physical condition. Specific learning disability is a term used to describe a disorder in one or more of the basic processes involved in understanding and using spoken or written language. It may manifest itself in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. It does not refer to students with a general intellectual disability. Students in this category have average or above average intelligence, but have a serious academic deficiency not consistent with their measured ability. Some common characteristics may include difficulty with retrieval and transfer of information, letter reversals and transposes, difficulty knowing left from right, distractibility, and poor self-esteem. Other impairments include speech-language impairment. That refers to a difference in communication skills so significant that it is apparent, disrupts communications, or affects emotional, social, or intellectual growth. The impairment may be in the inability to articulate speech sounds, to comprehend and/or use language. It may include an interruption in the flow of speech or voice impairment. Students with speech-language impairments may have difficulty communicating with the driver or with other students. Traumatic brain injury refers to an injury to the brain after birth caused by an external physical force, which results in a disability that adversely affects the student's educational performance. A student with this type of injury may require special seating, a protective helmet, or other special adaptations. A behavior management plan may also be in place. And finally, visual impairments. A student with visual impairment is one whose vision interferes with functioning in a regular school program. This term includes students who are functionally blind, legally blind, or partially sighted. Most students in this category have normal intelligence and learn well when appropriate techniques, materials, and equipment are used. These students may need guidance to get on or off the bus. They function better in a setting with assigned seats. Letting them know verbally when changes are going to occur is helpful. Practicing an emergency evacuation plan with visually impaired students is essential. Okay, name some degrees of delay. The three most common ones are mild, moderate, and severe or profound. And there's also significant development delay, which is associated with pre-K students. Okay, let's make a summary and review. Since transportation is a related service under IDEA adaptions involving the school bus, the method of pickup and delivery, the need for a monitor, and other special services may be included in the IEP based on the student's disability. Keeping to a consistent routine as much as possible is a key to successfully transporting these students. Recognizing each child's unique characteristics and need will help the driver in preventing upsets and disruptions. A visual schedule can help keep the student reassured and calm. A behavior management plan may be a part of the IEP. How do you apply this training? By working with teachers, parents, and administrators. The information that the bus driver receives from the teachers and parents will help to understand the specific needs of each student with disabilities. For example, the parent of a student with autism may inform the bus driver that Susie does not like anyone sitting too close to her. Therefore, the bus driver can make arrangements for Susie to sit in a seat alone or with only one specific designated student that would sit next to her. Meeting with teachers, parents, and administrators prior to transporting students with disabilities will help the bus driver and monitor meet the needs of each student's disability to ensure the bus ride is as pleasant, safe, and comfortable as possible. As a measure of performance, the bus driver and the monitor shall know terminology, recognizing characteristics, and being able to respond appropriately to students with disabilities. Welcome to the second unit for the Georgia Department of Education's mandated training for school bus drivers. In this unit, we will explain how to communicate with students with disabilities. Our objectives: to acquaint bus drivers and bus monitors with general tips of communicating with students with disabilities, and to acquaint bus drivers and bus monitors with specific tips for communicating with students with very specific types of disabilities. For the performance standards, the trainee shall be aware of different methods of communicating with students with disabilities. As an overview, we will be discussing about how to communicate with students that have hearing impairments, visual impairments, intellectual disabilities, orthopedic impairments, behavioral disorders, and speech and language impairments. Why is this important? Communication. The bus driver and monitor must have knowledge of how to communicate with students that have disabilities. These are students they will be transporting on a daily basis. How would you feel if you had a hearing impairment and there was an emergency situation in which everyone needed to evacuate the bus and the bus driver had no idea how to explain to you how to quickly get off the bus? You would probably panic. Every student should feel comfortable and safe when riding the bus and know what to do in an emergency situation. Let's look at some general tips for bus drivers and bus monitors for all students. First of all, be patient. What does being patient mean? Don't rush them. Give students time to respond to your request. Do not raise your voice. Why wouldn't we want to raise our voice? Well, because we might intimidate them, they might become more withdrawn, and we could upset students and cause them to become angry and actually rebel. Speak slowly, firmly, and clearly. Remember who you're speaking to and have an understanding of what kind of disabilities they have. For example, if they are blind, you don't need to talk slow or yell at them since they're blind, not deaf. On the other hand, if they are deaf, then you need to face them so they can read your lips. Talk with teachers and parents. You can learn more from the people that spend all day with these students. They can give us insight into what works and doesn't work with a student as an individual. Continuing with some general tips for the drivers and monitors, don't show anger or impatience. When you show anger or impatience, your body expression will tell everything. Example, if you say one thing and react another way, the student will react to your actions. Actions speak louder than words. Behavioral outbursts and or angry shouting at students inhibit rather than enhance the situation. Use simple vocabulary. Don't use big words. Use simple words. As an example, instead of saying enormous, say big. Be aware of the abilities of the students you are speaking to. Keep rules and limits at a minimum. Remember their attention span. Remember what disabilities you're dealing with. Have an understanding of how much they can understand. You don't have to give all the rules at one time. Break them up and give them in small pieces. Give simple instructions. For example, you just say bottom to bottom and back to back. Of course, what that means is that they have to sit down in their seat with the bottom to the bottom of the seat and the back to the back of the seat. Observe closely. You need to observe each student individually and know some history of their disabilities. And finally, in general, for all drivers and monitors, remember the emergency evacuation plan. You should have a written emergency evacuation plan. Why do special ed buses need a written evacuation plan? Because everyone needs to know what to do in case of an emergency. You may not have a monitor on the bus to help, and you may not have students that can assist in an evacuation. It's important that you practice the evacuation plan twice a year. Practice it so that everyone on the bus will know what to do in a real emergency. If it is a real emergency, there will not be time to try to decide what to do. Demonstrate with your hands what you want the student to do. Point to emergency exits, windows, and hatches. Demonstrate how to open each. Orally cover the evacuation plan in simple words and terms, and be aware of the abilities or disabilities the students you are speaking to. Remember, practice it twice a year. Now, let's look at specific tips for drivers and monitors, starting with students with hearing impairments. Face the student when you speak. If you are not facing or looking at the student when you talk to them, how are they going to know you're talking to them? It's the same with us. If you hear someone talking, you will turn your head and look. But if you don't see anyone looking at you when you look, you think that no one is talking to you. Write simple notes. Use flashcards. Flashcards are cards that have pictures of words or objects that a student can point to. This is how the student communicates. Point or demonstrate with your hands. When you point to something, everyone will turn and look, even the hearing impaired. Demonstrate with your hands when you're trying to get the point over to them. They are smart and they will try to help you if you will let them. When I was working with hearing impaired, I couldn't sign a word, but I would point or demonstrate, and they would teach me the sign. That's how I learned to sign. Basic sign language can be helpful. Some simple basic signs for good morning, stop, what is your name, etc. Let's consider some tips for students that have visual impairments. Call the student by name. You don't need to yell because they're not blind, not deaf. Since the students can't see you looking at them, they won't know you're talking to them if you don't call them by their name. Give clear directions for what you want done. Sometimes people might point when giving directions, but most visually impaired students can't see. If the student understands you and hears you talk to them, ask the students if you can help them. Take the student by the arm and lead them, or offer your arm or hand to lead them. And talk with the teacher or parent for specific tips. Teacher and parents might have suggestions on what works best with the students. Each student is different, and what works with one student might not work with another student. Remember that each student is an individual and has a separate need and different levels of understanding of instructions. Let's talk about communicating with students with intellectual disabilities. Again, use simple vocabulary. Give short directions. Example, move to this seat, stand up, sit down, walk, don't run. Demonstrate what needs to be done. Example, how to sit in a seat, how to exit the bus, how to use the handrail. Talk with the teacher or parent for specific tips. Teachers and parents might have suggestions on what works best with the specific student. Again, each student is different, and what works with one may not work with another. Remember that each student is an individual and has separate needs and different levels of understanding of instructions. Okay, so let's look at some questions here. What are some ways to communicate with students with hearing impairments? The answer includes face the students when you speak, write simple notes, point or demonstrate, use basic sign language if you can. What are some of the ways to communicate with students with visual impairments? And for that answer, call the student by name, give clear directions, talk with the teacher or parent for specific tips. What are some ways to communicate with students with intellectual disabilities? Use simple vocabulary, give short, clear directions, and demonstrate what needs to be done. Okay, some communication tips with students with orthopedic impairments. Check to see if there are any adaptations, such as positioning or a safety vest. Selective seating may be helpful. It helps to have assigned seats on the bus. If you assign seats, then the students know where they're going to sit before they get on. It also helps when there is a substitute driver that day. Have an evacuation plan ready and talk to the students. They have an orthopedic impairment. Most of them can communicate. They just might not be able to move around very well. Ask them questions and listen. Not only will you open up a line of communication, but you just might learn something. Many students with orthopedic impairments have medical conditions that also affect their ability to speak. They have to use other methods of communication. Sometimes it may be just simple yelling or screaming and rather large, grand movements. But if you pay attention to patterns and understand the context in which they make those statements or those grand gestures, you can begin to understand what they might be trying to communicate to you. For instance, if it's hot and they're pointing to a window or banging toward the window, maybe what they're simply asking you to do is open the window. So again, take the time and notice the patterns. Many times they are capable of communicating a message, but you have to be able to understand it from the context in which they're trying to express themselves. Let's talk about students with behavioral disorders. Check and work closely with the teacher on a behavior management plan. Every student that is in special needs has an IEP, and the IEP tells about the student. Every behavioral disorder has a behavior management plan. The teachers and other staff have worked on a plan that works with this student. Selective seating may be required. Assigned seats are a good idea because the students will know where to sit every day. Some students may not get along well with others. It also works when there is a substitute on the bus. A broken record is when you tell a student to do something or not to do something and repeat it until the student does whatever you've said. It usually takes about 3 to 5 times. The point is to say the same thing until the student does what you've told him to do. Don't argue. Stay with the broken record technique. Most of the time, the student will try to get your attention off of them and on to something else by saying something like, "Did you see Judy? She threw that piece of paper," or "She hit him." No matter what the student says, you stay with the student you were using the broken record with by saying something like, "I will take care of Judy as soon as you sit down." Then start back with the broken record. How do you communicate with students with speech and language impairments? Listen carefully. Students with speech and language impairments know what they want to say, they just have a hard time trying to get it out. If you will take the time to talk to them and get to know them, you'll be able to understand them. Ask the student to write you a note. Just because the student has a problem with speech or language doesn't mean that they can't communicate. Try asking them to write it down. Even if they don't spell everything correctly, you can probably understand what they mean. Use gestures. Gestures are simple. You can point or motion to what you want them to say. Use simple vocabulary. For example, stop, sit, walk, don't run. Some students may use technology for assistance. Find out if the student uses technology for assistance, laptop, handheld devices, etc. Okay, some questions here. What are some ways to communicate with students with orthopedic impairments? For our answers, check adaptions or safety vests, check their tie downs and positioning, assign their seats, evacuation plan, talk to them and listen to them, ask them questions and listen. Next question, what are some ways to communicate with students with behavioral disorders? Work closely with the teacher and the parents, especially working closely with the teacher on the behavioral plan. Use assigned seats and use the broken record technique. What are some ways to communicate with students with speech and language impairments? Listen carefully, ask the students to write you a note, use gestures, use simple vocabulary, find out if the student uses technology for assistance. Okay, let's summarize and review these general and specific tips on communication. Bus drivers and monitors need to know how to communicate with students with disabilities. Remember to be patient. Don't rush them. Do not raise your voice. They might withdraw. Speak slowly, firmly, and clearly. Remember who you're speaking to. Do not show anger or impatience. Your body expression will tell everything. Use simple vocabulary. Don't use big words, and do be aware of their disabilities. Keep rules and limits at a minimum. Remember their attention span. And finally, observe closely. How do you apply this training? Knowledge, understanding, and communication. By using the knowledge and understanding of the different methods of communication with students with disabilities that you transport daily, it's very important in ensuring your students a pleasant and safe ride. You may have a student that is visually impaired and you will need assistance in getting on or off the bus. The student should feel safe and secure as he or she enters or exits. Measure the performance standards. Bus drivers and monitors shall know how to communicate. Thank you for your attention. The introduction to the Individualized Education program will cover many aspects of the educational rights of children with disabilities. We will review the program known in short as an IEP and also the federal laws that govern our school systems in order to ensure that every child, regardless of his or her disability, is given the opportunity to have a free and fair education. Some of the federal laws and their implications that will be addressed are Section 504 from the Rehab Act of 1973, IDEA, or the Individuals with Disabilities Act, FAPE, or Free and Appropriate Education, and ADA, or the Americans with Disabilities Act. In this lesson, we will discuss these terms and how each affects school bus transportation. For the objective, it is to provide the necessary information to the school bus driver and the bus monitor needed to comply with federal law mandates related to the transportation of special needs students. Also to acquaint the school bus driver and bus monitor with the Individuals with Disabilities Education Act of 1990, and to acquaint the school bus driver and the bus monitor with Section 504 and its federal mandates. As a performance standard, the trainee shall be able to describe what an IEP is and the basics of IDEA. As an overview, we're going to talk about the laws protecting rights of disabled students, the IEP, what it is and what it does, transportation as related services, and your role as the driver or monitor. Why is this important to you? The federal law mandates that students with disabilities receive fair and equal education that may require special services, and it may require that transportation be modified to meet those needs. Okay, First, I want to welcome you to the world of acronyms. What is an acronym? An acronym is the word formed from the initial letters or parts of a word, like USA is United States of America, or one that's near and dear to us, commercial driver's license. The acronym is CDL. Okay, the first law we talk about is the Rehab Act of 1973, with Section 504 specifically. This is the first federal law to codify the rights of the disabled. It prohibits discrimination against qualified individuals with disabilities by any government program or activity that receives federal funds. It cannot exclude these individuals from participating in those programs, and individuals cannot be denied the benefit of those programs. It has been the basis for lawsuits and other legal actions over disputes such as length of a ride, reimbursing parents for transportation costs, etc. EHA, or the Education for All Handicapped Children Act of 1975. This law outlines the variety of special education-related services that must be provided to all handicapped children. This defines transportation as related service. It has several terms named in this law, FAPE, LRE, and the IEP, which we will discuss. It ensures that parents participate in the development of the IEP for their child, and it provides federal funding to help states bear the additional cost of educating handicapped children. FAPE is Free Appropriate Public Education. This term was introduced through the EHA of 1975 that we just discussed. It requires free education and federal funds to provide money for free related services. LRE refers to the least restrictive environment. It requires that children with handicaps be educated with their non-handicapped peers to the maximum extent possible in the least restrictive environment. It helps to eliminate labeling of children. Most of us are familiar with the saying, "He rides the short bus." We know what that indicates. It may require local systems to pay a bus monitor to ride on a regular bus to achieve that goal. The IEP, or the Individualized Education Program. This plan must be in a written form, written for students with disabilities. It must follow the law. It has to be written by a group of people. It is used to set goals for that child to meet as a part of that child's individual educational program. It will identify special or certain instructions to be used in assisting the child, and it will identify related services. Let's look at the IEP team. That's going to consist of a parent, guardian, or surrogate, a special needs teacher of the school system, a qualified transportation supervisor perhaps, individuals who need to be used for interpretation, and where appropriate, perhaps the student him or herself. The parent has as much input in the IEP meeting in determining the services to be provided to their child as anybody else. Transportation personnel may be represented at the meeting if modifications, special equipment, or circumstances are involved. Among the IEP considerations, they look at the age or the size of the child that would affect transportation. We may need to install a seatbelt harness or a child car seat. We would look at the type of disability. Are they medically fragile? Do they have brittle bone syndrome? If that's the case, we need to be careful about where we place them on the bus to minimize jarring as we go over bumps. Behavior. How aggressive is the child? Do we need some sort of restraint system or perhaps even a monitor? Precautions. Does the child have hepatitis, AIDS, or other diseases that may require extra caution with contact with their body fluid? We see that children with runny noses or a cough, they sometimes get cut or scratched. Someone may vomit on the bus. A nurse. Does this child have their own personal nurse? You'll have to make sure that there's accommodations for transporting of the nurse. And a bus monitor. They may need more than just one. Additional considerations. Medications. Is the child diabetic, have a lot of allergies, maybe asthmatic? Special equipment. Does the child use an oxygen bottle? What about a motorized wheelchair or an IV? How will you strap it down if that's the case? Curb to curb. This determines the location of the bus stop for the student. Travel time. Some students cannot ride for more than 20 minutes. Some cannot deal with the heat for long periods of time. Communication barriers. Maybe they are nonverbal and cannot tell you what is going on with them. Some children cannot express how they feel about something that may be going on around them. And then canine companions. Let's talk about that specifically. Dogs are the only animals allowed on the school bus. You will have to find somewhere to put the dog. Will you secure the dog for travel? What if another child on the bus is allergic to dog dander? Related services. The child may need to receive special services to help them meet their goals in their IEP, such as physical therapy, counseling, etc. The most important one I want you to note here is the last one, transportation. Transportation is a related service prescribed under the law, refers to transportation that must be provided to the student to and from school, in and around the school building, and it may need specialized equipment such as a wheelchair ramp on a bus or a bus with air conditioning. Students must receive a full day of instruction. It is important to remember that you should not go to school early to get a child out of class so that you can get rolling on your route earlier. The special needs student is entitled to a whole day of classroom instruction too, so some schools write into the IEP the loading and unloading of the bus as a part of their instruction. Okay, name one of the acronyms that determines how school bus transportation will be involved. It is the IEP that defines the type of transportation that is to be provided to a student with disabilities. The IEP shall be available to each school administrator and/or related service provider, such as a transportation supervisor, who will be responsible for its implementation. Information containing the student that is shared with the bus driver and monitor should be held as confidential and should only be given out under certain situations. IDEA, the Individuals with Disabilities Act of 1990. Part B of this law renamed the Education for All Handicapped Children to the current IDEA. It changed all previous references to handicapped children to children with disabilities. It added two new categories of disabilities, autism and traumatic brain injury. The Americans with Disabilities Act of 1990. This gives civil rights protections to individuals with disabilities similar to those provided to individuals under the basis of race, color, sex, national origin, and religion. It guarantees equal opportunity for disabled individuals in public accommodations, employment, transportation, state and local government services, and telecommunications. It is a little bit different from other areas of discrimination because in other areas of discrimination, you're encouraged to treat everybody the same. Treat black people the same as white, men the same as women, for example. But with people with disabilities, it actually encourages you to look at individuals and their situations and needs, and to accommodate according to those differences in needs. Okay, so what is your role in this? You're to provide transportation services, support to the parents, promote the child's development, and document events if need be. In summaries, we've gone over the laws protecting rights of disabled students. We've gone over the IEP, the Individualized Education Program. We've gone over transportation as related service and your role in this. How do you apply this training? Use the information provided in the IEP and federal laws to provide safe and professional transportation services for students with disabilities. And as a measure of performance, you should be able to describe what an IEP is and the basics of IDEA. Welcome to Unit 6 of the special needs training mandated for Georgia school bus drivers. The subject of this training is confidentiality of information and records. Our objective is to teach the driver the protocol for the state and federal laws regarding the disclosure of student information. As a performance standard, the trainee shall demonstrate knowledge of protocol of the state and federal laws in regards to the student confidentiality of information and records. Every student must be protected under federal laws and regulations pertaining to the privacy and confidentiality of student records. When communicating about students, you must make sure you don't give away any personally identifiable information. FERPA means Family Educational Rights and Privacy Act. The Individuals with Disabilities Education Act, IDEA, the federal law concerning the education of students with disabilities, requires schools to provide the parents of a child with a disability with a notice containing the full explanation of the procedural safeguards available under the IDEA and the U.S. Department of Education regulations. No special education records should be kept in a student's permanent records. They must be kept in a separate locked file. Education records means the type of records covered under the definition of education records in the law. Departments will not release records to any person or agency without parental permission or approval unless the disclosures are in accordance with the federal and state guidelines. Only the school system's Department of Special Education may disclose personally identifiable information from special education records. Records will be released to other schools when students enroll and upon written request. The procedural safeguards notice must include a full explanation of all the procedural safeguards available under the laws. Parents of a child who have been referred for special education services or who are already receiving special education benefits have certain rights which are protected by the state or federal law. FERPA stands for the Family Education Rights and Privacy Act. It applies to all agencies and institutions that receive federal funds, including elementary and secondary schools, colleges, and universities. The purposes of FERPA are twofold: to ensure that parents have access to their children's educational records and to protect the privacy rights of the parents and the children by limiting access to those records without parental consent. FERPA deals with access to education records, parental rights to inspect and review the records, amendment of the records, and destruction of the records. Remember, it is necessary to be extremely careful should the opportunity arise, whether professionally or socially, to use a student's name in casual conversation. Even mentioning a child's name when questioned or speaking about a service population can identify them as special needs students. This is a breach of confidentiality. Okay, so name the two purposes of FERPA. One is to ensure that parents have access to their children's educational records, and the other one is to protect the privacy rights of the parents and the children by limiting access to these records without parental consent. Name four requirements that FERPA has. FERPA deals with access to educational records, parental right to inspect and review the records, amendment of the records, and the destruction of the records. Important factors for drivers to consider. The parents have entrusted you with their children, and that trust includes respecting a child's confidential information. Do not participate in rumors regarding the students. Do not release written or verbal confidential information to the public. You must comply with all the local and federal laws and regulations and ensure the confidentiality of any personally identifiable information. Ensure that all of the security measurements before divulging information and provide accurate information. The law requires that the school system have the appropriate release from the parents. They have to ensure that the parents and the guardians have been fully informed and that all information is provided to the parents in their native language. They have to have appropriately documented and signed consent prior to disclosing information. All the affected parties are the parents, perhaps the eligible students, school officials, other educational programs. The important thing here is for you to understand that your job is to drive the bus and that you are a party who must comply by maintaining confidentiality. It is not your job to gather consent forms. It is your job to maintain the confidence. So, as safeguards, all system employees must keep student information confidential, and you must be knowledgeable of our procedures and policies for the release of information. You must maintain all confidential and personally identifiable information in a secure manner, and you must confidentially transfer all personally identifiable student information only to those who have a need to receive it. In summary, we've gone over the importance of confidentiality, the reasons of confidentiality, knowing your procedural safeguards, and to whom, when, and how to release student information. How do you apply this training? By maintaining the confidentiality of the students that you transport. Don't talk about them, and do not share written information with them except with other school officials who may have requested that information. Thank you for your attention to this matter. This is Unit 11 of the Special Needs Units of the Georgia Department of Education's mandated training for school bus drivers in the state of Georgia. In this unit, we're going to talk about student behavior management for special needs students. For our objectives, we're going to have an understanding of the importance of a good student management, have an empathetic understanding of disabilities, have knowledge of procedures and techniques of student management, and develop communication strategies to assist with management of the students. As our performance standards, the trainees should be able to understand the need for good student management and gain an empathetic understanding of students with disabilities, student problems, and knowledge of procedures and techniques of student discipline. For the overview of this unit, we're going to have an introduction, categories of disabilities, tips on maintaining discipline, interventions for disruptive behaviors, inappropriate interventions, and general rules and regulations for student management. All students thrive on structure and routine, especially those with disabilities. All students, including those with disabilities, should know and follow school bus safety rules. The IEP governs everything that we do for students in special education. This includes behavioral and safety concerns on the school bus. Positive interactions with students, parents, and school staff will help us to remain professional in our approach. It is important to understand your reactions to student behavior and how your behavior impacts the situation, especially during times of anger, frustration, and anxiety. The categories of disabilities, we talked about these in Unit 1. There's autism, deaf and blind, emotional and behavioral disorder, otherwise known as EBD, deaf and hard of hearing, mildly intellectual disability, moderate, severe, or profound intellectual disabilities. There are orthopedic impairments, specific learning disabilities, speech-language impairment, traumatic brain injury, visual impairment and blindness, and with young children with disabilities, significant developmental delay. Okay, having just seen the list, can you name 6 categories of disability from which students may receive special education services? And again, here you see the list in its entirety. Some tips on maintaining discipline. We must teach the students appropriate behavior on the school bus. This should be done both on the bus and in the classroom. By communicating effectively with the students' teachers, we will be able to assist them in developing appropriate responses to student behavior on the bus. If necessary, a behavior intervention plan should be established that will address bus behaviors. We must remain calm in difficult situations. Role modeling desired behavior means that we will demonstrate respect and empathy toward our students and demonstrate the kind of behavior that we would like them to display. Developing positive relationships with our students is the #1 key to success as a driver. Use of assigned seating can help you maintain some control of difficult situations. Knowing who needs assigned seating and remaining consistent with that seating is important. When students misbehave and have to be moved to an alternative seat, there should be some way for him or her to be able to earn the privilege of sitting in their former seat. Okay, what are 3 tips for maintaining discipline? Teach and reinforce appropriate behavior, communicate effectively with the school staff, remain calm and consistent, role model the desired behavior, develop positive relationships with the students, and use assigned seating when necessary. Okay, let's look at interventions for disruptive behaviors. Ignore inappropriate attention-seeking behavior when possible. Children who act out in order to gain attention are often reinforced for this behavior when we give them attention for that. Attention, positive or negative, is still attention. Provide choice of alternative behavior. There are times when students will behave inappropriate when they have nothing else to do. It is often necessary for students with disabilities to be given something to do while on the bus. Provide directives and reminders when rules are violated. It is important to let students know what the rules are on a regular basis. If they continue to violate rules and regulations in the bus, it will be necessary to involve the teacher in an effort to find other ways to communicate with the student. Use of verbal and nonverbal cues for appropriate behavior. There are times when the student and the driver will benefit from establishing an individual system that will work as a reminder for the student to behave appropriately. Connect the bus behavior to the classroom management system. Most special education teachers have some sort of classroom management system that the student is operating under each day. Often misbehavior on the school bus can be managed through the classroom system. Design a behavior contract with the student and his teacher. Beyond the typical classroom management system, teachers can assist you in the development of individual behavior contracts with students regarding disruptive behavior. Question: what are 3 appropriate types of interventions for inappropriate behaviors? We've got several here. Ignore the inappropriate attention-seeking behavior when possible. Provide choices for alternative behaviors. Provide directives and reminders when rules are violated. Use verbal and nonverbal cues for appropriate behavior. Connect bus behavior to classroom behavior management systems, and design a behavior contract with the student and his teacher. Let's talk about interventions prohibited by law. Anything that is designed to or likely to cause pain. Release of noxious, toxic, or otherwise unpleasant sprays, mists, or substances near a student's face. Denial of adequate sleep, food, water, shelter, physical comfort, or access to bathroom facilities, and subjecting the individual to verbal abuse, ridicule, or humiliation, or cause emotional trauma. Continuing with the legally prohibited interventions, it is illegal to have restrictive interventions which use a device or material or objects that simultaneously immobilize all 4 extremities, including the prone containment procedure, except when an emergency is situated by trained personnel. In other words, you cannot tie a student up or use devices to restrain them. It is also illegal to engage in the denial of adequate supervision of individuals and depriving individuals of one or more of his or her senses. Okay, what are 4 inappropriate types of interventions for inappropriate behaviors? Anything that is designed to or likely to cause pain, release of noxious, toxic, or otherwise unpleasant sprays, denial of adequate sleep or bathroom facilities, subjecting the individual to verbal abuse, restricting them or restraining them using devices that would immobilize them or tie them up, denial of adequate supervision, and depriving individuals of one or more of his or her senses. Disciplinary procedures. When there are consistent behavior problems on the bus, a transportation department representative and/or the driver may be invited to participate in an IEP meeting. This is typical following chronic or extreme behavior problems. Students who misbehave on the school bus can be suspended from the bus. The procedures for suspension from the school bus are governed by the requirements of the law. Inappropriate behavior on the bus must be documented. Drivers have a responsibility to communicate with school staff regarding misbehavior on the bus. Since the bus is considered an extension of the classroom, there should be ongoing instruction regarding bus expectations. It is the IEP team's responsibility to create an individualized behavior intervention plan for students who display chronic inappropriate behavior. Okay, question. Who is responsible for the development of an individualized behavior intervention plan? The answer is the IEP team, which may include the driver and a representative from the transportation department. General rules and regulations for student management. The drafting of rules and regulations governing student conduct on school buses is the responsibility of the local Board of Education. These are some of the general considerations that must be met in order to promote safe transportation of the students. The driver must become familiar with the local rules and regulations and instruct the students on rules and regulations. You will notice that the rules and the regulations for special needs students really are not any different from that of regular education students. Instructional suggestions. Review your expectations consistently throughout the year. Work toward a positive relationship with each child, especially the most difficult ones. Maintain good communication with the home and the school. Document behavior problems and work with the school to develop alternative strategies when necessary. Use positive reinforcement. Work toward understanding the student's disability. Remain calm at all times and role model desired behavior. Remain professional in your approach. How do you apply this training? By better understanding the behavioral characteristics of students, you will be more prepared to deal with the disciplinary problems that arise on the school bus. You will benefit from creating positive relationships with the students on the bus. You can use this training as a guide for communicating with students' teachers and schools administrators. How do we measure the performance standard? We'll be observing you as you drive students with special needs. Thank you for your attention to this unit.